Any part of you can look like this, or this, just like the stars who walk the red carpet. So how do they do it? And how can you get that look? Hi everyone, I am Marilyn Capote, your host for our brand new beauty and wellness program right here on CW6, Celebrity Secrets MD, the place where you can find out all those secrets. Get ready to meet our top docs, board-certified surgeons and medical specialists offering state-of-the-art procedures to help you defy the aging process and be your best in any decade. You know the new math, right? 60 is the new 40, 50 the new 30, and 40 is the new 20. And that's why you need to watch our show, because we're going to meet the people who know how to keep you looking your best at any age.
To me, beauty is in the eye of the beholder, because everyone sees beauty differently.
Beauty is proportion, it's balance. It's not overdoing it, but it's bringing it back to a natural look.
The key to success in beauty is doing things gradually and doing them naturally.
First up, the latest innovation in plastic surgery catering to the stars and you. Artful design when it comes to fine-tuning your face. Meet Dr. Robert Bonillas with the latest in lifting your best features.
The celebrity look, to me, it's an illusion, as you said. Unfortunately, we're looking at what I like to call the post-production look of the celebrity, meaning we're looking at it in print and we're looking at it on TV. So with that being said, there's a lot of photoshopping. It's not about trying to look like someone or trying to have that perfect face or those perfect eyes or nose. To me, it's about finding what's beautiful about my patient and enhancing that beauty. First and foremost for me, it's understanding the patient's concerns, their specific concerns, and seeing if those concerns are realistic and moving forward with what I can provide for them. We call it the Life Lift, and what it is, it's spelled L-Y-F lift, Life Lift, and what that stands for, it's Love Your Face Lift. And we feel that patients that come in and have these procedures, it's a facial procedure, it's a full facelift, we know that they're going to love their face. It's pretty guaranteed that they'll like it. And the reason is that because by doing it in the office, A, it's not necessarily less invasive because it is a fully invasive procedure. B, it's cheaper, obviously, because you're saving on hospital fees and anesthesia fees. It's not just your run-of-the-mill facelift. It's not come in during your lunch hour and let's give you a little tuck and you're done. This is an actual full facelift. It's not a lifestyle lift. It's not a quick lift. This is a real facelift, and I can do these facelifts under local anesthesia, and it's very comfortable. Most of my patients sleep through the entire procedure. They're very comfortable. When they come for their post-operative visits, they tell me, you know what, I don't remember what happened. It was so comfortable. And better yet, they are so happy with the results.
Up next on Celebrity Secrets MD, what's new in body contouring? Get ready for the Ultra Shape machine and find out the secret the Kardashians use to keep their backsides camera ready.
The number one thing that a lot of the celebrities are using is the VeloShape. The VeloShape, the Kardashians, they have their own in their own house that they use. I swear, you can't make this up.
And a little later on, flashing that $1 million smile for your own fans, we've got the updates on what's trending now in cosmetic dentistry.
Shocking but true, the electric facial is a hot trend among celebs in Hollywood and Beverly Hills. Put on one scary-looking mask, add a healthy jolt of electricity, and the combo gives your facial muscles a workout. The ultimate result? Glowing, tighter skin. Ouch.
You've got them, but you don't want them. You know, love handles. A little extra on the thighs, struggling with those last few stubborn pounds? Body contouring is a great way to get a jump start. Meet med spa specialist Charles Small and his state-of-the-art machine. Ladies and gentlemen, introducing UltraShape.
UltraShape has come out and has blown away everything on the market that we even know about technology-wise in body contouring and fat destruction, fat cell destruction, permanent fat cell destruction. There's different ways. You can either have some type of a thermal event, whether it be cooling or heating. So you're heating up the fat cell and basically shriveling it up. You're gonna freeze it, cool sculpting. It does work, it does a great job, but it's gonna freeze it. You're gonna see, it's gonna take time. It takes time to break down that little cell that's been frozen. Your body has to slowly break it down and get rid of it. First time I tried UltraShape, I saw results literally 3 days. I'm not saying everybody's gonna see them in 3 days, but my results I started seeing noticeably in 3 days. It's gonna use an ultrasound that goes down, it delivers a pulse down into the tissue. It has no damage to the nerves, connective tissue, blood vessels, anything like that. It goes down, shakes the fat cell to the point where it ruptures. You have that sudden rupture and decrease in the fat, and you have these triglycerides now that were trapped in those little fat cells. Those are gonna process through a lot quicker than when you were to freeze them or heat them. They're gonna get processed through the liver. Liver's gonna break them down, and then you're gonna get rid of them. It's FDA approved to drop you 2 sizes within about, you're gonna start noticing results in the first 2 weeks. Cool sculpting, you're gonna start noticing in maybe 1 to 2 months. We use, ideally, a combination, UltraShape and VeloShape. So when you kill the fat cells, and not everybody does this, when you kill them, you need to tighten what's left. Otherwise you have a saggy skin. So the VeloShape comes along, it's a great complement to that treatment. It's gonna tighten up the collagen, the elastin fibers. It's gonna tighten all that up and get rid of any like little dimpling, marks. The circumference, it's gonna decrease the circumference of, say, your leg, your stomach, your arm. I mean, honestly, it does wonders for you. Cellulite, it blows it away.
And Charles has a celebrity scoop when it comes to those Kardashian behinds.
The #1 thing that a lot of the celebrities are using is the VeloShape. The VeloShape, the Kardashians, they have their own in their own house that they use. I swear, you can't make this up. They have their own machine in their house that they use for their legs, their stomach, mostly behind the legs, to decrease the cellulite before they go for a big modeling shoot or something on TV. They hit the VeloShape, tighten it up, and look fantastic.
You can connect with Globe Med Spa and find out more about UltraShape online or call for a consultation. Coming up, Celebrity Secrets MD goes back into surgery to learn more. But first, we present our Physician Spotlight feature.
Definition of beauty, a majority, as you mentioned, a majority of my patients are female. There is a certain percentage of males that are seeking plastic surgery. When I look at a female patient that comes into the office, I try and educate and say it's about balance, right? Beauty is proportion, it's balance. It's not overdoing it, but it's bringing it back to a natural look. You know, I couldn't think of a better career to where you go to work every day, you're helping people, you're challenged by what you do, and you know, in my case, lots of variety. I love what I do.
If your eyes are your best feature, enhancing them with natural-looking lashes could be the best investment to perk up and pop out your eye color. Eyelash extensions have been big among the celebrity crowd for years, but now everyone is getting in on the big lash look. For about $100, you can get a basic set of eyelash extensions that will last 6 to 8 weeks. Or you can bam it out and pay a lot more for faux mink lashes. Go big or go home, ladies. And don't go away. We've got a lot more to come on Celebrity Secrets MD. Celebrity Secrets has the questions you need to ask your plastic surgeon. Here's our top 6. Are you an accredited board-certified plastic surgeon with proper training? Will insurance cover my procedure? Am I a good candidate for plastic surgery? Should I have separate or combined procedures? How much downtime should I expect? And what should I know about the recovery process? That's Celebrity Secrets MD, Top 6 FAQs.
Time now for our Celebrity Secrets MD crew to go back into surgery to find out more about what's cutting edge in the plastics today.
When it comes to saying I want to look like this movie star, I don't promise anything in that sense, and I try and explain to them why it may or may not be possible. It's like the foundation of a house. You can do whatever you want, however the foundation is set. And your body, your breast dimensions, your facial features and dimensions are set. So we work within that and ultimately find out that that's the natural beauty that that person has. It's not creating something that they aren't. No plastic surgery is meant for weight loss. It's for contouring, it's for giving you better aesthetics. So we say, you know, if you're going to eat Twinkies and burgers, everything we did is going to be undone with time. So follow a healthy lifestyle, exercise, and even then it's a matter of just being smart about things. Tummy tuck, first and foremost, addresses loose skin of the abdomen. Second, it's going to actually tighten your waistline. So especially people that have increased or lost a lot of weight, let's say. There's lots of massive weight loss patients. Women with one childbirth or multiple childbirth, that portion of your abdomen gets distended and the elastic properties are gone. And no matter how many sit-ups you do or crunches, you name it, you're still going to have a little bit of a protuberance there. So we bring in the waistline, we give you more of a flat abdominal contour, and then we determine how much skin excess you have. And resect that, and eventually you're to a result that is something you could not accomplish in the gym. After the recovery period, you know, people are well on their way, and a lot of times it's motivating. It gets them back in the gym or eating right because they went through all this. They want to have their results last. You know, first step is when a patient's seeking a plastic surgeon or cosmetic surgery, they need to be assured that the person that they're consulting with is a member of the American Board of Plastic Surgery. That's the first step in assuring their safety. The patient's going to have a good outcome, and they're going to be in the hands of an accredited, well-trained surgeon. That's the first step. Unfortunately, there's lots of smoke and mirrors out there, and lots of unofficial societies and memberships that look great on paper or look great on a website, but it does not speak to the surgeon's experience and training. The silicone implants are perfectly safe. Now, from then to now, we're now probably 5 generations, 6 generations beyond that particular implant that caused the concern. So nowadays we're putting in silicone. I put in probably 90% silicone implants. I think it gives you a better breast shape, better breast feel, less concerns with rippling, and the latest implant is an anatomic shaped breast implant.
Still ahead on Celebrity Secrets, time to dazzle with that $1 million smile. Celebrities flash those pearly whites almost as often as paparazzis flash their cameras. Find out about the fastest way to get that gorgeous smile for yourself.
We call it our red carpet throwback as we go into the vault to uncover celebrity secrets from those iconic stars of Hollywood days gone by, like Italian bombshell Sophia Loren. Her best beauty tip? Olive oil in her daily diet, bubble bath, and on her face for a glossy, healthy glow. Nice.
Cosmetic dentistry is hot and available for everyone. So got teeth? Come on and get a gorgeous smile.
Well, you certainly see in all the commercials and ads out there, it seems that just about everything whitens teeth these days. From all the studies I've seen, I guess about 60% of the time the smile is the first thing that's noticed on a person. So it is important. Something to mention here about teeth whitening, that at the end of the day, it's actually not teeth whitening. So what we're doing is we're removing the stains from the teeth. It's impossible to make teeth any whiter than what they were created at, but we can restore the teeth back to their, back to when you were basically a teenager. Is teeth whitening for everyone? I would say for the vast majority of people it is. There can be a very small percentage of people that have extremely sensitive teeth. Even though we have ways of dealing with sensitivity today, some people at the end of the day just may experience too much sensitivity. But that's such a small number of clients, and I've probably done over 4,000 of these, and I've had 2 people that deemed wouldn't be suitable to have their teeth whitened. The particular laser treatment that we use is absolutely amazing. The results are phenomenal. We have reviews all over the internet. I say you don't necessarily have to believe me. You can go and see what the general public says about the treatment. But basically, I think what differentiates our process from some of the other ones out there is it's very customized. We have actually 5 different whitening treatments contingent upon a client's requirements. Teeth whitening is just not one of those things that you really can take a one-size-fits-all and a generic approach. Everybody's teeth is different. You have age, lifestyle, diet, habits, all those things need to be considered. So our treatment's very customized. We take quite a bit of information from the clients and use that in order to facilitate the correct whitening treatment for them. Our laser system is one in that it heats up the gel in a fashion that doesn't actually heat up the teeth. It forms little microscopic oxygen bubbles that get deep down into the tooth and actually remove the stains off the enamel, inside the pores, and then also lightens the dentin. So on average, our clients can see anywhere from 10 to 20 shades whiter, and the average being about 14 to 16 shades in a single treatment. One of the things that I've seen with the clients through the years is it's what I would call a facial transformation. You know, there's a lot of cosmetic procedures out there that can benefit a person, but in all my years, I've never seen anything quite as dramatic and immediate as teeth whitening. What it does to one's appearance is amazing. When somebody looks at your face, they divide it up into light, into dark segments. And a lot of times, especially if you're Caucasian, light, fair-skinned, it can get a little washed out. It can get a little flat looking. Once we can get the teeth whiter than the whites of the eyes, now all of those have pop. the brows, the lashes, the eyes have pop to them. And what I hear clients say is, after they had their teeth whitened, people come up and say, "You did something. Is it the hair? Is it the skin? You did something. What is it?" And to me, the greatest cosmetic treatment out there is when you look better, but nobody knows what you did.
Next week, we pull out the genie wand to transform those wrinkles into smooth skin and crack open the vault to discover more celebrity secrets. And that's it for this edition of Celebrity Secrets MD. Thanks for watching. I am your host, Marilyn Capote. And remember, shh.